Have you ever stopped to think about what actually protects the inside lining of your blood vessels, day after day, decade after decade, without you noticing it? Most people have never thought about it. We think about cholesterol. We think about blood pressure. We think about the dramatic events, the heart attack, the stroke. But we don't think about the silent daily plumbing of millions of miles of arterial wall, and we don't think about what feeds it. Today, I want to walk you through two vegetables, just two, that have been studied more thoroughly than almost any other foods in the cardiovascular research literature, and that act on your cardiovascular system through two completely different biological mechanisms. Not one mechanism shared twice, two genuinely different mechanisms. And once you understand both of them, you're going to see why a category of food that most people eat once a week, if they eat it at all, deserves a much more serious conversation. Now, I want to be honest with you right from the start. I'm not going to tell you that eating these two vegetables will fix your heart, that they reverse disease, or that you can throw your medications away. I am not a doctor, and I'm not qualified to give you medical advice. What I am going to do is show you what the published research has actually found, what the mechanisms look like, where the evidence is strong, and where the evidence is still preliminary. Because the biology behind these two vegetables is, in my opinion, more remarkable than most of the dramatic health claims that you see online, and it rarely gets explained properly. Here's what we're going to build. First, we're going to talk about what is actually happening inside your cardiovascular system on a normal day, the kind of daily wear and tear that accumulates quietly for years. Then we're going to introduce the first vegetable and follow the nitric oxide pathway, the molecule your endothelium needs to keep your vessels relaxed and elastic. Then we're going to introduce the second vegetable and follow the potassium pathway, the electrolyte that does more to modulate blood pressure at the population level than almost any other dietary factor in existence. Finally, we're going to put both of them together and tell you what the morning or the day actually looks like when you layer them in. The whole thing should take about 15 minutes, and I think the explanation will change how you look at a plate of food. Let's start with the basic problem. Your cardiovascular system is under constant low-grade assault, not from dramatic events, from ordinary physics. Every time your heart beats somewhere around 60 to 100 times a minute, around 100,000 times a day, blood is pushed against the inside walls of your arteries with measurable force. That force is your blood pressure, and the walls of your arteries are living tissue. They respond to that force. They expand and contract. They communicate with the blood flowing past them. They release signaling molecules. They make decisions about inflammation, about repair, about when to constrict and when to relax. The single most important molecule in that daily conversation is nitric oxide. I'm going to spend real time on nitric oxide because once you understand it, the first vegetable won't just be a recommendation. It will feel like the obvious answer to a specific biological problem. Nitric oxide is a gas. Yes, a gas. Your body actually manufactures a signaling gas and uses it molecule by molecule to communicate with itself. It is produced by the endothelial cells, the single layer of cells that lines the inside of every blood vessel in your body. When nitric oxide is released, it signals the smooth muscle wrapped around the vessel to relax. The vessel dilates, blood flow improves, blood pressure falls, platelet aggregation is reduced. The vascular system behaves exactly the way it's supposed to behave when nitric oxide levels are healthy. But here's the part that most people don't know. Nitric oxide production declines with age. It declines with poor metabolic health. It declines in the presence of inflammation, oxidative stress, sedentary behavior, and diets low in the specific compounds that feed the nitric oxide pathway. And when nitric oxide production declines, the endothelium becomes stiff, vessels become less responsive, blood pressure rises, the cardiovascular system loses its flexibility. This is not a dramatic event, it's a gradual drift that happens over years. So the question becomes, What can be done to support nitric oxide production through diet in a way that the evidence actually supports? And this is where the first vegetable comes in: beets, beetroot. The red root vegetable that most people associate with pickled slices on the side of a salad plate. Beets contain one of the highest concentrations of dietary inorganic nitrate of any commonly eaten food. And dietary nitrate is the raw material that the body uses to manufacture nitric oxide through a pathway that completely bypasses the conventional enzymatic route that becomes less efficient with age. Here's how the pathway works, and I want you to hold on to this because it's genuinely elegant. When you eat beets, you consume nitrate, NO3. That nitrate is absorbed in your upper digestive tract and enters your bloodstream. Your kidneys filter out about 60% of it and excrete it, but the remaining 40% is concentrated in your saliva and recirculated. Bacteria on the surface of your tongue, specifically the commensal bacteria that live in the deep crypts of your tongue dorsum, reduce that nitrate to nitrite, NO2. When you swallow that saliva, the nitrite encounters the acidic environment of your stomach and is further reduced to nitric oxide, which then enters your circulation. Your body is using your own oral microbiome as a chemical reactor to manufacture a signaling molecule. That is not a metaphor. That is the biochemistry. The 2018 American Heart Association issued a scientific statement formally recognizing the role of the oral microbiome in nitric oxide biosynthesis, which tells you how seriously this pathway is now taken in mainstream cardiovascular research. Multiple randomized controlled trials have now tested beetroot juice as an intervention for blood pressure. A 2013 trial published in the journal Free Radical Biology and Medicine by Gilchrist and colleagues demonstrated significant reductions in both systolic and diastolic blood pressure in individuals with type 2 diabetes after a 14-day supplementation period. A meta-analysis published in 2016 in the European Journal of Clinical Nutrition that pooled data from multiple trials concluded that inorganic nitrate from beetroot is associated with clinically meaningful blood pressure reductions. More recent work has shown improvements in endothelial function, measured as flow-mediated dilation, the standard test of how well your blood vessels dilate in response to increased blood flow. The signal across these studies is consistent. Beetroot-derived nitrate lowers blood pressure, improves endothelial function, and supports the exact mechanism that declines with age. Now, I should be careful here because the science demands honesty. Not every study has shown the same effect. A 2015 randomized controlled trial published in the American Journal of Clinical Nutrition by Bondono and colleagues did not find significant blood pressure reductions in already treated hypertensive patients over a 14-day period. The researchers pointed to high baseline blood pressure, concurrent antihypertensive medication use, and individual variation in oral nitrate-reducing bacteria as plausible explanations. This is the kind of nuance that gets stripped out of clickbait headlines. The honest summary is, beetroot-derived nitrate has a real, reproducible, mechanistically explained effect on blood pressure in healthy adults and in many mildly hypertensive populations, with effect sizes that vary depending on baseline health, oral microbiome composition, and concurrent medication use. Saying beets cure blood pressure would be dishonest. Saying beets meaningfully support the nitric oxide pathway that governs vascular tone is what the evidence actually supports. Let me also be clear about the practical limits. To get the dose of nitrate used in many of these clinical trials, between 300 and 500 milligrams of nitrate, you would need to consume roughly 200 to 300 milliliters of beetroot juice, or somewhere between 100 and 200 grams of cooked beets, depending on the variety and how it was grown. That's a meaningful portion. It's not impossible to incorporate, but it's also not a casual sprinkle. And the effect is dose-dependent and time-limited. The blood pressure benefits from a single dose of beetroot juice tend to peak around 2 to 3 hours after ingestion and persist for roughly 24 hours before declining. This is not a one-time fix. It's a recurring biological input. The pathway is daily, not occasional. Now let me introduce the second vegetable, and it does something completely different from the first. Leafy greens, spinach, kale, Swiss chard, arugula, collard greens, romaine, the entire category. The reason leafy greens are a second independent pathway rather than a duplication of beets is that they operate through potassium, the major intracellular electrolyte that regulates fluid balance, vascular tone, and blood pressure through mechanisms that have been studied at the population level for decades. Let me give you the magnitude of what potassium does, because it is genuinely larger than most people assume. A 2017 meta-analysis published in the journal Hypertension, pooling data from multiple randomized controlled trials, found that increased potassium intake was associated with significant reductions in both systolic and diastolic blood pressure. A more recent dose-response meta-analysis covering trials from 2000 through 2024 confirmed a clear inverse relationship between potassium intake and blood pressure across populations. The effect size is meaningful. Across multiple analyses, the consensus is that potassium supplementation accounts for somewhere between 50% and 75% of the blood pressure benefit seen in dietary interventions like the DASH diet. The Dietary Approaches to Stop Hypertension trial, which was a landmark 1997 study published in the New England Journal of Medicine, showing that a diet rich in fruits, vegetables, and low-fat dairy could lower blood pressure as effectively as a single antihypertensive medication in some participants with mild hypertension. The mechanism is fundamentally different from the nitric oxide story. Nitric oxide tells vessel walls to relax. Potassium does something more architectural. It signals the kidneys to excrete sodium. When sodium excretion rises, fluid volume drops. When fluid volume drops, the total volume of blood circulating through the arterial system drops. When circulating volume drops, pressure on the vessel walls drops. In parallel, high potassium intake directly relaxes the smooth muscle of blood vessel walls through hyperpolarization of vascular smooth muscle cells, a separate pathway from nitric oxide. Two mechanisms, one inside the kidney, one inside the vessel wall itself, both pointing in the same direction. Leafy greens also deliver folate, a B vitamin that breaks down homocysteine, an amino acid that, at elevated levels, is associated with endothelial damage and increased cardiovascular risk. They deliver magnesium, another electrolyte that supports vascular relaxation. They deliver antioxidants including lutein and beta-carotene that reduce oxidative stress on the endothelium. They deliver fiber, which feeds the gut microbiome and produces short-chain fatty acids that, as I covered in a previous video, support systemic metabolic health. A cup of cooked spinach delivers close to 840 milligrams of potassium. That's about a quarter of the daily target intake most cardiovascular guidelines reference. A single cup. Now let me extend the evidence one more layer, because there is a population-level finding here that I think deserves attention. A meta-analysis published in the Journal of Nutrition in 2021 by Lee and colleagues looked at green leafy vegetable intake and multiple health outcomes across the available observational literature. The finding that genuinely stands out: each 100 gram per day increment of green leafy vegetable intake was associated with approximately a 25% reduction in the risk of all-cause mortality, coronary heart disease, and stroke. This is an observational finding, not a randomized trial. Observational data shows association, not causation. People who eat more leafy greens also tend to exercise more, sleep better, smoke less, and have higher socioeconomic status. The researchers attempt to control for these confounders, but they can never fully control for everything. So let me say this carefully. The evidence shows that populations eating more leafy greens have measurably better cardiovascular outcomes, and the size of the effect is large enough that it has survived adjustment for known confounders and is consistent across different study designs and populations. That is a strong signal. It is not proof of causation by itself. Now, let me bring in the dimension that makes this whole story sharper. The two vegetables are not just independent in their mechanisms. They are complementary in a specific and useful way. Beets work fast. The nitrate to nitric oxide pathway operates on a timescale of hours. Beetroot juice can produce measurable vascular effects within 2 to 3 hours of consumption. It's a relatively acute intervention. Leafy greens work structurally. The potassium-driven mechanisms operate through renal sodium handling, blood volume regulation, and chronic endothelial support. Their effects build over days and weeks of consistent intake. This means that the two vegetables act on different timescales and on different nodes of the cardiovascular system. One gives you a near-term vascular signal. The other gives you a long-term structural substrate. Combining them in a regular dietary pattern is, mechanistically, more complete than either one alone. There's also research suggesting that nitrate and the compounds found in leafy greens may have synergistic effects, since the nitric oxide pathway benefits from reduced oxidative stress, and leafy greens are dense in the antioxidants that protect nitric oxide from being scavenged before it can do its work. The same Lee et al. Analysis noted that green leafy vegetables contain not just potassium, but a combination of nitrate, folate, magnesium, and fiber that may act together rather than independently. Now, here is what I want to be specific about because I think specificity matters. If you wanted to build a daily pattern around these two vegetables, what would that look like in a way that respects the dose-response data? For beets, the practical approach is somewhere between 100 and 200 grams of cooked beetroot, or 200 to 300 milliliters of beetroot juice, on most days of the week. Roasted or steamed beetroot retains its nitrate content well. Boiling leaches a portion of the nitrate into the cooking water. Fermented beet products like beet kvass also retain nitrate. Raw beet juice is the most concentrated form. Refrain from consuming it as a single dramatic dose. Spread it through your week. For leafy greens, the target is somewhere between 200 and 300 grams per day across the category. That can be spinach at breakfast, a mixed salad at lunch, sautéed kale, or Swiss chard at dinner. Variety matters here. Different leafy greens have different concentrations of potassium, folate, and the accessory compounds. Spinach is high in potassium and folate. Kale is high in vitamin K and antioxidants. Arugula delivers nitrate along with peppery glucosinolates. Mixing them is better than relying on one single type. If you want to layer them efficiently, you can build a single meal around both. A salad with spinach and arugula as the base, roasted beets on top, a source of healthy fat like olive oil to support absorption of the fat-soluble antioxidants, a handful of walnuts or pumpkin seeds. That single meal is delivering both the nitric oxide substrate and the potassium substrate in a balanced ratio. There are also considerations that deserve honesty. Beets contain oxalates, which at high intake levels can contribute to kidney stone formation in susceptible individuals. The betalain pigments that make beets red can cause harmless bituria, red urine in some people, which is unsettling if you don't know what's happening. People on certain blood pressure medications, including nitrates and phosphodiesterase inhibitors, should be cautious with concentrated beetroot juice because the combined vasodilatory effects can amplify medication effects. This is not a recommendation against beets. It is a recommendation to be aware of interactions and to talk to a healthcare professional if you're on medication for a cardiovascular condition. I'm not your doctor. I'm not qualified to give you medical advice, and I would rather be honest about that than pretend I am. Leafy greens interact with blood thinners like warfarin because of their high vitamin K content, which can interfere with the medication's mechanism. Dark leafy greens are also high in vitamin K. If you're on warfarin or a similar medication, you don't need to avoid leafy greens. You need consistent intake and medical guidance so your dosing can be calibrated. I want to close this with a broader observation because I think the bigger picture is what makes these two vegetables worth talking about. Cardiovascular disease is, in most countries, the leading cause of death. It accounts for roughly 17.9 million deaths globally per year, according to the World Health Organization. The pharmaceutical industry has built an enormous infrastructure around treating the downstream consequences. Statins, antihypertensives, anticoagulants, antiplatelet agents, all of them effective, all of them necessary for many people. But the upstream interventions, the dietary patterns that support the fundamental mechanisms underlying cardiovascular health, get a fraction of the attention and a fraction of the funding. Beets and leafy greens don't replace any of that medical infrastructure. I want to be very clear on that. They support the biological substrate. They make the system more resilient. They give the endothelium the raw material it needs to keep producing nitric oxide. They give the kidneys the electrolyte they need to manage fluid balance. They give the vascular smooth muscle the conditions it needs to relax. And they do this through mechanisms that are independently well documented, mechanistically understood, and reproducible across the research literature. You don't need a dramatic intervention. You don't need a single superfood that cures everything. You need consistency, and you need two vegetables that act on genuinely different parts of the same system. When you understand the mechanism, the choice stops being a wellness opinion and becomes a structural decision about what biology you're feeding. So, if you haven't already, try this for a few weeks, not as a test, not as a clinical trial on yourself, just as a pattern. Beets most days, leafy greens most meals. Track how you feel, not just physically, but in the subtle background metrics that often shift when cardiovascular support improves. Energy through the afternoon, quality of sleep, recovery from exercise. The body's quiet reporting system is more accurate than most of us give it credit for. If this video helped you see these two foods differently, make sure to subscribe to the channel. And if you want, leave a comment telling me which of the two mechanisms felt more surprising to you, the nitric oxide story or the potassium story. Thanks for watching, and I'll see you in the next video.